Good morning, students. Today I am going to discuss to you another nursing theorist who contributed in the nursing profession. She talked about the relationship-centered care, the human caring theory by Margaret Jean Watson. Margaret Jean Watson was born in southern Western Virginia and grew up during the 1940s and 1950s in the small town of Welch, West Virginia. She is a nurse by profession. In 1966, she took up master's degree in psychiatric mental health nursing and pursued her doctoral degree in educational psychology and counseling in 1973. According to Watson, love is the highest level of our evolved being consciousness. Love is the motivation for compassionate human service and authentic caring. The role of the love and conscious heart demonstrate a shift from head-centered orientation to evolving heart-centered living. We shift from being driven by our egos, which is the head, and the paradigm of fear, competitive approach to caring, which is the heart, teaching, helping, loving approach personally and professionally. The heart is an energetic field that transcends our perception that the brain is in control. At the personal level, we must open our hearts and surrender, repattering ourselves from caring, healing work. Jean Watson is an American nurse theorist and nursing professor who is well known for her philosophy and theory of transpersonal caring and has been integrated into education and patient care to various nursing school and healthcare facilities all over the world. Watson's philosophy and science of caring is concerned on how nurses express care to their patients. Her theory stresses humanistic aspect of nursing as they intertwine with scientific knowledge and nursing practice. Transpersonal care focuses on helping patients achieve a more complete sense of harmony within mind, body, and spirit through the use of caring transaction. Now, Watson further described that a transpersonal nurse as one who has the ability to center consciousness and intentionally on caring, healing, and wholeness rather than on disease, illness, and pathology. Watson also defined three of the four meta paradigm concepts in nursing, including person or human being, health, and nursing. She referred human being as a valued person that has to be taken care of, respect, nurtured, understood, and assist. In general, a philosophical view of a person as a fully functional integrated self, human is viewed as greater than and different from the sum of his or her parts. Now, Jean Watson defined health as a high level of overall physical, mental, and social functioning. A general adaptive maintenance level of daily functioning, and the absence of illness or the presence of effort leading to the absence of illness. Now, take a look at this picture. This is the activity of daily living. When we say activity of daily living, this is a term used to collectively describe fundamental skills that are required to independently care for oneself, such as eating, bathing, mobility, grooming, toileting, dressing up, socializing, and activity. So if a person can be able to participate or to perform this daily activity, that person is considered to be physically healthy. Now, Watson also defined nursing as caring. Caring science helps us to embrace the positive energy that flows from an integrated mind, body, and spirit, and is mutually rewarding to both the patient and the nurse. Okay. Positive mindset creates a positive energy. Now, Jean Watson did not define the fourth meta paradigm concepts of environment, but instead devised the 10 caring needs, specifically the curative factor, critical to the caring human experience that needs to be addressed by nurses with their patients when in a caring role. Now, the term curative means caring with love or to cherish. The first three factors form the philosophical foundation for the science of caring, and the remaining seven comes from the foundation. The first one is the formation of humanistic altruistic system of values. This is, in short, the humanitarian heart, beginning developmental at an early age with values shared with the parents. This is mediated or applied through one's own life experience, the learning one gains and exposure to the humanities. It is also perceived as necessary to the nurse's own maturation, which then promotes altruistic behavior towards others. When we say altruistic, this is having or showing an unselfish concern for the welfare of others. The second one is faith hope. It is essential to both the curative and the curative process. When modern science has nothing further to offer the person, the nurse can continue to use faith hope to provide a sense of well being through beliefs which are meaningful to the individual. The third one is cultivating of sensitivity to one's self and to others. Explores the need of the nurse to begin to feel an emotion as it presents itself. Development of one's own feeling is needed to interact genuinely and sensitively with others. Striving to become sensitive makes the nurse more authentic, which encourages self growth and self actualization in both the nurse and those with whom the nurse interacts. The nurse promotes health and higher level functioning only when they form person to person relationship. Number four is the establishing a healthy or a helping trust relationship. Strongest tool is the mode of communication, which establishes rapport and caring. Now, the characteristics needed to in the helping trust relationship are congruent, empathy, and warm. Communication includes verbal and nonverbal and listening in a manner which connotes empathy. Number five is the expression of feelings, both positive and negative. Feelings alter thoughts and behaviors, and they need to be considered and allowed for in caring relationship. Awareness of the feelings helps to understand the behavior it engage. Number six is the systemic use of the scientific problem solving method for decision making. The scientific problem solving method is the only way that allows for control and prediction and that permits self correction. The science of caring should not be always neutral and objective. Number seven is the promotion of interpersonal teaching learning. The caring nurse must focus on the learning process as much as the teaching process. Understanding the person's perception of the situation assists the nurse to prepare a cognitive plan. The number eight is the provision for a supportive, protective, and or corrective mental, physical, socio-cultural, and spiritual environment. Now, Watson divides this into external and internal variables, which the nurse manipulates in order to promote or to provide support and protection for the person's mental and physical well-being. The external and internal environments are interdependently. Nurse must provide comfort, privacy, and safety as a part of this curative factor. Number 9 is the assistance with the gratification of human needs. It is based on a hierarchy of needs similar to the Maslow's hierarchy, which I am going to discuss to you further as we come or as we tackle Maslow's hierarchy. Each need is equally important for quality nursing care and the promotion of optimal health. All the needs deserves to be attended to and valued. Watson ordering of needs are lower order needs, which is the biophysical needs. Lower order needs is which is the psychophysical needs. Higher order needs, which is the psychosocial needs. And the number 4 is the highest order needs or interpersonal needs, intrapersonal and interpersonal needs. Now, under the lower order needs, these are the needs for food, the need for food and fluid, the need for elimination, and the need for ventilation. Now, under the lower order needs or psychophysical needs, these are the needs for activity, interactivity, and the need for sexuality. The higher order needs or the psychosocial needs are the need for achievement, the need for affiliation. And lastly, the higher order needs or the intrapersonal and interpersonal needs are the needs for self-actualization. Now, the last curative factor is the allowance for existential phenomenological forces. Phenomenology is a way of understanding people from the way things appears to them, from their frame of reference. Existential psychology is the study of human existence using phenomenological analysis. This factor helps the nurse to reconcile and mediate the incongruity of viewing the persons holistically while at the same time attending to the hierarchical ordering of needs. Thus, the nurse assists the person to find the strength or courage to confront life or death. Now, as a summary, okay, caring can be effectively demonstrated and practiced only interpersonally. Okay, without interaction, there will be no caring. Okay. Caring consists of curative factors that results in the satisfaction of certain human needs. Okay. Effective caring promotes health and individual or family growth. Caring responses accepts person not what he is or what she is now, but as what he or she may. A caring environment is one that offers the development of potential while allowing the person to choose the best action for himself or herself at the given point in time. Caring is more on healthogenic than curing. A science of caring is complementary to the science of curing. Okay. And lastly, the practice of caring is central to nursing. Okay. To end up this discussion, we'll end up with a quote. A constant attention by a good nurse may be just as important as a major operation by a surgeon. Okay. So, this ends up my discussion or this ends up my slides. Should there be any question, just feel free to ask me during our interaction session. Thank you for this day and have a nice day, everyone.